We're live. There we are. All right. Well, hi, everyone. I'm here today with Dr. Tracy Pfeifer from the Pfeifer Aesthetic Plastic Surgery Center in New York City. And we did masks last week, and today we're going to talk about gloves. So you want to go ahead and start with a little background?
Where are my gloves? Well, I think we wanted to talk today about gloves. And before we get started, I just wanted to send a message to all the patients out there. Brave is wonderful in terms of supporting women who have had breast cancer and need breast reconstruction so they can feel the best about themselves that they possibly can. And I know all of that's delayed during this COVID crisis. And I just want to send a message to everybody that any person who's had their chemotherapy interrupted, their reconstruction delayed, maybe you are waiting for a breast biopsy, or your uncle needs his hip replaced and he's in a lot of pain. The doctors, the medical community, all of the professional societies are very aware that there are a lot of patients who are in need of medical care, and everybody's working as hard as they can to get things back in order so that you can receive the medical care that you need. So we all know you're out there, and everybody's working really hard so you can get the medical care that you need and deserve. So today we thought we'd talk about gloves. And as Beth knows, because she's out there talking to people in the community, there's a lot of confusion about it. In fact, the CDC doesn't recommend that we wear gloves, right, Beth?
That's right. So, well, there's a few instances where they do. If you have a sick patient, you want to wear gloves if you are doing laundry of someone who is COVID positive, and also cleaning up around them, and I believe doing dishes as well.
Right. So in the medical world, we wear gloves, and these are just the small ones that we wear. They come in these kind of big boxes. And if we're in the hospital, for example, whenever we go into a room, we're always going to put on a pair of fresh gloves so that when we touch the patient, there's nothing that could be on our hands that could get to the patient. So from that standpoint, gloves do protect you and people that you're working with from spreading germs. The problem is if you wear your gloves and you're kind of using them for everything and you're not really remembering that you still have to change them in between everything that you do or wash your hands in between everything that you do, you could still be spreading the virus around your house. So I think we could agree that if you have somebody in your family who is COVID positive and you're occasionally helping them, it's probably a good idea to wear gloves when you're interacting with them, maybe if you're taking the dishes out of the room to wash them or something like that. But even in those situations, it's really best if somebody's COVID positive, if that person is in their room doing their own thing for 14 days and they really don't have any interaction with the family, but sometimes that's hard to do. So I like to wear gloves, even though the CDC doesn't recommend it for routine things like grocery shopping, because I feel like I have my gloves on, I can go to the grocery store and touch things, put them in my car, get them in the bag, and then before I get them into the apartment, what I do is I take my gloves off, and the way you take them off is you take it from the end like this, and you roll it over. So the outside glove is going inside. So now this inside part that I'm touching, there's no way that this is contaminated. So it's clean, and then I just drop it on the floor, I put it in the garbage pail. And I put on a new pair of gloves. And then I spray my groceries and bring them into the house so that they're clean. But some people don't want to do that. So all you're going to do instead of wearing your gloves is when you go out, do your thing and remember that you're touching things that potentially have the virus on, and then you have to wash your hands. So I feel like I'm washing my hands less if I wear gloves, and it's hard on my hands to wash them constantly. They're getting really dry and like cracked and horrible. So that's why I like to wear gloves, but you don't have to, but you just have to wash your hands frequently. And I also feel like the gloves protect you because it prevents things from getting underneath your nails. And I think we all should probably be keeping our nails short during this time period anyway. And if you have a nail brush when you come home and you're washing your hands, it would be a good idea to go with it with a nail brush underneath your nails to get them really super clean. Now, the other thing, yeah, go ahead.
I just had two questions on what you just said. Oops, do you hear that feedback?
A little bit.
I wonder what that is. Okay. So you said you clean or you go back and you spray your groceries. Do you do that with the gloves on, or you do that after you take the gloves off?
I do it either with a new set of gloves on, or I wash my hands and I do it without any gloves on. Okay. And I want to tell everybody that you can also get these, because a lot of times you can't get these boxes of gloves, and the healthcare providers or healthcare heroes still need them. So you can wear a pair of gardening gloves and you can put them in the washer. They work.
So I'm curious on the way you said you take them off. I don't think I could take these off the same way that you just took those off, because they're a little bit stiffer. Let me just try. Oh, yeah, no, I just lied. Okay, I can't.
And you can just throw it in the washing machine and wash it.
Okay.
That's possible. And you can also use these big gloves that our mothers used to wear for washing dishes. And these come in different sizes. And basically, you can do a lot with these. You could do a lot with those. And you can get them off. You could also here's what I do to take things off also sometimes. I have a whole bunch of little like rags that are clean. You can grab the end of it with the rag and pull it off. And then you just dump the whole thing in the washer. Okay. That works really good. That works really good. I have like 50 rags that are just clean all the time, and I'm always using them to touch things. That works really well. And then the other thing that I wanted to show people, because we're having a hard time getting Lysol and alcohol in some areas, there's something called Phase 1, which is the brand name of a company that we use for a medical product. And the product itself is hypochlorous acid. So hypochlorous acid basically kills bacteria and viruses in a very safe way. So it's not toxic to your tissues at all. In fact, our bodies make hypochlorous acid. It's part of how we kill bacteria that's in our body. The cells make it. But there's this really cool thing from a company called Force of Nature. And this little little device comes, you plug it in. And you put in this solution. One of these things is a solution. You dump it in here and you add regular tap water. And it will convert the solution to hypochlorous acid. And then you put it into the little spray bottle. And I use this to spray all my mail, boxes, surfaces in the kitchen, anything that you want. You can put it on a rag and use it on the door handles, your keyboards, whatever you want. It's safe for your skin to touch it. And on the device that creates the hypochlorous acid, it has an indicator light. So when it's green, it means it's still going to be active. And after 14 days, it will change color to tell you that you need to make a new batch. When we get it in the office for medical purposes, it comes in this dark amber bottle, which preserves the activity of the product. So we can keep this on the shelf for many, many months. But in the house, it's going to last about 2 weeks, and then you make a new batch. And I just think it's a terrific product. I have no vested interest in it. I found out about it on YouTube from a YouTube mommy. And I just think it's a terrific product. It's easy to use, and you don't have to worry about getting alcohol and Lysol spray and things like that.
No, that's great, because around my house, things are getting bleached because we're spilling the bleach on the rugs and things. So
yeah. And when you activate this, it will smell like chlorine. Because it is hypochlorous acid, and it will. It smells like an overly chlorinated pool, but it's still safe. It's not toxic, and I don't know if it will bleach anything or not. I'll do a little fabric test over the next few days and see if it does, and can report back to you.
Great. Well, we're going to try to. We went a little long last week on the mask one, so we're going to try to keep this one a little shorter. But I don't. If there's any questions anybody has, send them in, and. We will go over that. I did see somebody actually commented, great information on the nails. So that's good, Tracy.
Yeah.
So, all right. Well, unless you have anything else, I think we'll sign off for today. And if we come up with anything else, then we will keep doing these, because I think it calms people down a little bit. People are a little clearly frightened for good reason, but at the same time, it needs to be a little bit of a balance. And as things change, we want to stay on top of it and help patients.
Well, just a reminder, you really shouldn't be frightened. These are easy, common sense things to do that are extremely effective. Just remember, I mean, our healthcare heroes are in the hospital surrounded by COVID 1,000% of the time. High levels of the virus are around them. They are wearing the right PPE. They're changing their gloves. They're washing their hands. They're changing their clothes when they come home. And thank goodness now we think most of the healthcare workers are safe. A lot of them did get sick in the beginning because they didn't have the right PPE. So for us at home with very low levels of virus or perhaps even no exposure to the virus, doing these simple things, wearing your face mask, washing your hands, wearing gloves if you feel more comfortable that way, and wiping down surfaces, you are going to be safe. So no need to be overly concerned. Just be careful.
Great. Thank you, Tracy.
All right. See you soon.
Bye.
Bye.